What's up, you guys? I'm Dr. Nick. Thanks for clicking on this video. If you saw one of my YouTube shorts earlier today or earlier this week, you may have seen the patient that had a ingrown toenail that came from a pedicure. Well, that's what I'm going to show you here. We're going to talk about why this happened. So this patient had a pedicure done, and there was a corner of the toenail that was clipped with an effort to try to remove the pain that the patient was having. And what they ended up doing was clipping a small piece and leaving another piece behind, and that piece becomes a spike, and we just refer to that as a nail spike. And in this particular patient, you're going to see what happens here. It grew out of the end of the toenail. So let's watch this. So the patient presented, she came in with, just complained of an ingrown toenail from the pedicure, and we discussed our options, and she wanted to have it temporarily removed. So you can see we're numbing the toe. There's 4 nerves around the great toe that we numb. If you've watched any of my other videos, you'd see us doing this. This is called a digital block. We use some cold spray, and we try to hit all 4 of those nerves around the great toe. So the needle doesn't go anywhere near the toenail. It goes in the base of the toe. It's really not as painful as you think it would be. We try to go slow, and we use a small 27 gauge needle, which is really tiny, so it's less painful. So after the toe gets numb, we wait about 5 minutes, and then we will go back and start the procedure. So we use sterile gloves, but this is basically a non-sterile procedure because it's a toenail, it's infected already. And we do prep the toe with betadine solution, so that's already been done. So I'm just getting ready now to go in with our instrumentation, which is set up here right next to the toe. Patient is calm, she's lying back, she's excited to get this removed because remember, she had a pedicure done, she thought she was doing something good for herself, ended up getting an ingrown toenail. And you can see there's a large collection of bleeding and inflammatory and infectious material that's hanging in that corner. We're putting a tourniquet on now, and that just slows the blood flow down while we're doing this procedure. So the patient can't feel anything right now. It's completely numb. They don't even feel the tourniquet, they'll feel pressure. This is a small 62 blade. It's a chisel blade that we use, and that's going to kind of transect the toenail. It'll make a small slice down the toenail and remove that area that we don't want. So first we're using a freer, and this freer is just like a small spatula. It goes in and frees up the nail fold from where that ingrown toenail is growing into the nail. And we're trying to just take a small portion. We don't want to disrupt the rest of the toenail. Then we'll use a nail nipper. In this case, I have a tissue nipper, and we're going to cut a small portion of the nail, and that gets our cut started. So I'm trying to identify how much of the nail I want to remove. And we just make a small little cut, and then we're going to take that chisel blade that I was demonstrating earlier, and we're going to make that cut all the way under the cuticle, or what we refer to as the eponychium. So the nail plate is now cut. And now we're going to remove it. So we'll use a pair of hemostats to grab the toenail, and you're going to see here what happened and why this pedicure caused this ingrown toenail. So the person who cut the toenail didn't get it all, and they pulled and they left a little spike. So you see that little spike? That spike is what's growing out of the end of this person's toe because the nail continued to grow, and it pushed through a pocket in the skin and created an infection. This is very common. So now I'm going in with a curette, and we use this to make sure we didn't leave any debris behind. And now you're going to see I'm removing some excess skin that builds up. We call this a granuloma. It's an inflammatory process of the skin in reaction to the nail plate that was pushing on it. And now this is when I discovered there's a hole there, and there's actually some necrotic fatty tissue that's underlying that area where the toenail was. Now watch here, we're actually sticking a curette through that hole that the nail plate had created. And now we're just going to snip it all away. And that's it. Patient's done. We'll put a layer of Neosporin or antibiotic ointment on. It gets bandaged up for 24 hours, and they're done. So thanks for watching this video. If you have any questions about why pedicures are bad, or you want to see some of my other videos, you can click on them here. Drop any of your comments or questions below. I'll see you in the next video.